All right, guys, we're going to go ahead and get started here. Can everyone just give me a thumbs up if you can hear me? All right, looks good. Okay, guys, so we'll kind of get started here briefly with introductions. So if you don't know me already, my name's Tiana Weichert. I'm one of the exercise physiologists with Next Level, and today we're going to be going over concepts behind bulletproofing. So kind of, you know, if you haven't been to the clinic and you haven't been a patient, then you might not know what the role of the exercise physiologist is. And so basically what we do here at Next Level is we help to facilitate the care that's in office. And so what we do is we help to prescribe the exercises that you guys are going to take home with you as homework that you can kind of work on and kind of make the treatment that you get in office last for long-term effects here. So kind of the first thing that we'll get into here is I want to make a brief kind of note that the correctives and the concepts behind those correctives that we go over are purely meant for, you know, ancillary work and not really meant to replace what you're doing inside the gym or maybe if you're working out at home. And so really it's just meant to help supplement what you guys have going on so we can kind of produce the most range of motion, the most function for that range of motion, the stability across the whole board there. So just kind of one thing that I wanted to make clear to you guys there. So the goal of the corrective exercises that we give are to improve the new neuromuscular efficiency and the muscular endurance, and to some extent strength as well too. So that's kind of one common theme that we're going to kind of be implementing no matter what. And so kind of the first thing that we want to get into here, if we can see this board right behind me, we'll hit the ground running here with some brief explanation as to what happens during muscular contraction. And so kind of bring this closer. So first thing that we're seeing here is the different phases of our muscular contraction here. And so all these lines kind of represent the micro anatomy of our muscles. And so what's going on under a microscope, because we're obviously not going to be able to see this through the naked eye. So these all lines here all represent, like I said, the contractile units that kind of need to bring together and move kind of towards one another as we contract our muscle. And think as we're contracting a muscle, we can kind of think of a game of tug of war here. So picture each one of these little red dots that you see here as hands on a rope. So picture both sides of the team here. There might be multiple games of tug of war happening here where first off, you know, the first person or last person in line here might be doing a lot of the work here because the first two people really aren't doing much of anything. So this is telling us that we really don't have a lot of attachments happening there. So when our muscle is fully lengthened, we're not getting a great amount of force production happening there. Versus in the middle of our range of motion, we can kind of think of this as a bicep curl. So this first portion here is whenever our leg is fully, or arm is fully extended there. And then as we work through that range of motion, we get to the center here of our bicep curl where we're here, right? So we're seeing a lot of hands on the rope and we see a lot of connection happening here. So this kind of demonstrates our strongest point throughout that contraction. And then if you can see on the bottom, we see maybe, you know, one or two people again on each side here doing some of the work. So again, we've got some stragglers on the end where we're not getting a whole ton of force production. And so, you know, what this all kind of points to and what we're trying to really get at here is that, you know, you might be a little bit counterintuitive to think that, you know, it's weak here. And as we go out through the muscle contraction, you think that we might be able to get stronger and stronger going through that bicep curl. But realistically, the point whenever we're here at the end range and here at the end range, those are the two weakest points. And we can see that through this curve right to the right side of this board here, that as we go through that length tension relationship, say for that bicep curl, for example, here is our shortest point. So again, starting from the top And as we work our way through that range, it's about halfway at point, right? We're at our maximum contraction, and we can see a lot of effort actually being put on that because we're at our full tension. And then as we work down and through to the most lengthened point, we can see again that we're just not very strong in that range. So this just kind of points to the overall picture of why we need to train full range of motion whenever we're going through all of the corrective exercises. So big picture, big takeaway from all this jumbled mess is that, again, instead of maybe training isometrically or maybe even just, focusing on one aspect or one hold or one carry, we do want to focus to the full extent that we can, as long as we're not experiencing any like tightness issues. Of course, we would want to clean those up first, and then we would address the stability components. So next kind of concept that we want to go over here, now that we know why training the full range of motion is important, we kind of want to get into some of the basic methods that we're using to kind of play with those mechanics and really kind of work against this graph that we have going on here to really try to play up on these weak points here and try to train those up as best as we can, because that's really going to be our bread and butter as far as where we want to focus most of our attention from a therapy standpoint. Because if we tack these two weak points, right, if we train full range of motion, going slow, going controlled, we can kind of make things better for ourselves in the long run here as far as injury prevention goes. So first concept that we'll get into is the concentric phase or the shortening phase, which we know means bringing to center that just raising portion of the exercise itself. And then the eccentric phase is that slow, again, in that bicep curl, that lengthening phase. Again, we're really spending a lot of time under tension, kind of making a really nice mind-body connection. And then last is that isometric or same tension is what that really means. So a good example of that is just, again, a bicep curl here where we're holding strong onto that weight. And it's not really going anywhere, right? So we're going to focus most of our attention right on this eccentric phase, those slow, controlled, time under tension type exercises, because number one, it has a lot of therapeutic value to it, and it works. So a lot of patients have experienced a lot of benefit and just basic, quality of muscles and quality of joint integrity have maintained because of that. So a couple of reasons why we often prescribe eccentric exercises is number one, it just works for the full range of motion versus maybe the more of the isometric exercises. So don't get me wrong, like isometric exercises are pretty good for strengthening up a muscle under a certain amount of tension, but kind of the downside to that is it's joint angle specific, and it doesn't really have tons of transfer to, normal day-to-day activities, or, we don't function in silos where we're just kind of hanging out here in this range of motion or here, right, where we're strongest, but we're picking up things off the floor, we're putting things up on shelves, things of that nature. So we kind of want to think big picture and what the goal is here. And so that's kind of where we play into the lengthening phase. And so that's one of the first benefits. Now, second one, we kind of can get a little bit more of that. We talked about the proprioception, or that mind to muscle connection, where through that slow kind of phase that we're going through there, that increase of time under tension is really going to be great for our ability to kind of think about position and think about control and how we're monitoring the speed, things of that nature. And so we really want to focus our time on that. So it's just great from that standpoint. That's going to benefit us long term, because it's just great as far as having that connection. So next, kind of benefit here of these eccentric exercises is this really cool kind of tissue response that we can get from, that slow controlled movement that I think is really applicable to increase benefit to our concentric loads that we'll probably see in the gym more so than anything else. So if you picture your like bicep muscle here running up and down as this rubber band. So as we expand time under tension there, what we're doing is we're neurologically tricking our brain into thinking that this tissue now has to be responsible for handling a lot more load, a lot more speed, so that repeated bouts of doing this probably 3 times a week for a certain amount of weeks, we're going to see a lot of neurological response of this tissue, of maybe storing a lot more elastic capacity or elastic storage, so that it allows us to kind of handle maybe even more load, or maybe even some more reps through what we're experiencing inside the gym. So just a kind of another cool benefit of why we might prescribe an eccentric exercise over maybe more focusing on concentrics, or like I said, those isometrics. Maybe to a much more distal effect is this more efficient use of energy that an eccentric exercise has. So in theory, we're not using as much of the ATP or that energy storage for our muscle tissue in an eccentric exercise versus the concentric, which might speak to some volume that we might feel like we're able to handle a little bit more in our workouts if we were to do eccentrics versus concentrics. So just a kind of last little piece on that. One example that I think is pretty cool that I found in the research that kind of demonstrates the value of why we do eccentric exercise in a clinical setting versus maybe something like treating something with maybe something more invasive like surgery. So there's a study done in 2006 where they took 20 male athletes and non-athletic folks, where essentially they broke them in half. All of them had patellar tendinopathy, or that jumper's knee. So if I pull out the model, if you guys aren't familiar with what jumper's knee is, it's essentially the thickening of the ligament that's through here, or that tendon that's through here, right underneath the patella. So what happens is jumper's knee, you picture a lot of loading in through here, and it's explosive movements, it's repetitive. If you think about how many times a volleyball player or a basketball player has to jump in a game, you're spending a lot of time overloading these tissues. And so one kind of response that can happen is this thickening or that inflammation of that tissue. And sometimes people actually do need surgery on this. But what this study found was that, half of these folks got that surgery that's really meant to just resect or kind of strip away that tissue that kind of formed on top, that inflamed tissue. And the other half of the group went through 12 weeks of conservative eccentric exercises. And so really interesting thing that they found on that was that no measurable differences occurred between the surgical intervention versus the eccentric training population. And so I think that highlights a couple different important details there. So obviously, if you don't have to do surgery, obviously don't try the conservative method first. And I think it speaks volumes to the efficiency and the effectiveness that eccentric loading and exercises can offer in that scenario. So key takeaway from that, essentially, eccentric training is just a low risk and low cost solution or option to be considered before you have surgery. So that is kind of my spiel on why we want to focus a little bit more on those type of loading mechanics versus those isometrics or concentrics that you're really going to be focusing on more so at the gym, because that's mainly where you put most of your time trying to see how much load you can handle, how many reps you can handle. So that is my bit on that. now that we have a pretty good handle on why we pick certain exercises over others, we're going to get into here some of the numbers here as far as our sets and reps go. So what you're seeing here is basically sets and rep schemes that have been kind of set as guidelines by the American College of Sports Medicine. So they're a nationally recognized group. So I trust them. They're a pretty valid source of information here. So basically, of course, with power and strength and endurance, so intensity and volume here that you're seeing between the sets and reps are inversely related. So with power, we're doing a lot more weight with little amount of reps and sets being done here. So 1 to 2 sets, 2 to 5 reps, that's probably over 80% of your 1 rep max. So you're going to be handling on that. So where we kind of concentrate most of our focus here is within the strength and endurance kind of prescriptions here, as far as what we give you guys to take home with you to help mitigate, number 1, pain, but number 2, to help bulletproof, right? So really maintaining good joint integrity, and maybe even reassuring that we don't further the injury anymore. So like I said, certain different injuries that can occur, tendinopathies are pretty common here. So one thing that we might prescribe more often than not are these, within this range here, these endurance numbers. We might give you maybe 2 to 3 sets of 15 to 20 repetitions or more, because it's very light, it's very transferable across different age groups. It's easy to do. It doesn't require a whole lot of skill. So if somebody isn't really used to handling a lot of load, or just isn't really good from a skill component, then we're not going to give you strength to start out with. We might give you something a little bit less intense. With that being said, the way that we progress kind of has a lot to do with how well you are, where you start out, and what your kind of training experience and what your training age is. And so maybe for the first couple of weeks that we see you guys, we'll start out with something a little bit light. And then as you get better, as you get more confident, as you make that proprioception, or that mind to muscle connection, we can start to give you some of the more strengthening exercises here. So we'll start to give you a couple components to work against, whether it's increasing the amount of weight. We'll bump you up to maybe 8 to 12 reps instead of maybe doing so many of the 15 to 20 at less load. Not only are we playing with the weights, but we're also probably give you a little bit more volume to do overall. So we might ask you to do your sets and your reps probably more often throughout the week. On top of that, we'll kind of play with the stability. Now it kind of depends on what body area you're looking at. For lower body stuff, instead of doing, both feet, we might give you the option to do a single leg if we think you can handle it, and if we think that we're definitely stable enough to do so. Next kind of progression that we work with is maybe slowing things down, doing time under tension, or maybe even introducing pause reps. So that's always a great way to kind of make things just a little bit tougher for you guys, and kind of keep things interesting and challenging at the same time too. So all of this is done obviously with this overall goal here that I have written down here. So we always want to address kind of what your goal is right from the start, and so that we can safely get you to the point where you need to be, that it's safe, but it's also effective, and it's, really going to make a difference in the overall outcome that we're trying to get you guys towards. And so we might start you off with, really kind of mundane movements where you might be doing, these external rotations if you have shoulder injuries with these bands here. It's kind of not the most exciting exercise, but it's really helpful for kind of getting you started. We got to get your baseline somewhere. And so if we can emphasize that stability across that full range of motion first, and kind of work our way through there to the more dynamic, more multi-joint, or more of the exercises that are really going to mimic what it is you want to get back into, whether it's, getting back into your lifting technique or getting back into just working 8 to 10 hours a day, whatever it is, we're going to try to program things to make it as individualized as we can. So that is basically all that I have for you guys here. So I'll kind of unmute myself and I'll open the floor for questions here.
Hello, this is Paul. Could you please move the board over a little bit so we could see the percentages? Perfect. Thank you.
Hey, Tiana, this is Aaron. First of all, I thought it was really good information and super valuable right now, especially with, coronavirus and us being all stuck at home. I think this is, awesome stuff. One thing that maybe you could touch on a little bit is just, let's say you have a tendinopathy like you were talking about, and there's somebody stuck at home with coronavirus and they're trying to rehab it. Can you give me like an example case? Like, let's say I came in and I got jumper's knee. Walk me through real quick, like what that looks like, just so we may have an idea as far as how we can implement this if we can't, get into the clinic to get evaluated.
All right, can you guys hear me?
Yeah.
Okay. Yeah, so that's a really good question. So say if somebody came in with jumper's knee, obviously there's been that inflammatory response that we talked about here running along underneath this patella. So when it's been inflamed, then obviously it might be a couple of different things as far as causation goes. We might not be moving, correctly. We might be improperly loading the knee. So we would want to probably first examine their movement first, just see if we can break down any deficits from that standpoint. And the other component of that can probably be anything like, patellar length and kind of how we play into the anatomical components of it too. So sometimes it's, that's certainly not very common, but it can happen. And so any change in the anatomy there can kind of work against us in that standpoint. So whatever the reason might be, obviously surgery is not something we want to consider before doing any conservative trial or anything like that. And so a couple of things that we might do in order to combat that is just kind of break down those deficits in the movement wherever they might be occurring. We might just be getting improper tissue loading in the way that we're decelerating and landing on our jumps. And so we might prescribe as something as easy as, proper quad mechanics or proper like glute mechanics and stuff like that. And then on top of that, we're going to hit it with some ice and kind of compression on that so we can kind of reduce any inflammation at the site or local site there. But as far as exercises go, we're definitely going to give you guys something a little bit more, light load, probably banded. As far as sets and reps go, probably 2 to 3 sets of somewhere in the ballpark of 15 to 20 repetitions. And like I said, like quad extension stuff, just real slow, kind of controlled nature to the exercises there so that we can kind of get the mind to muscle connection going there again.
Awesome. Thank you. Yeah. And I know you touched on that, but basically what you're saying is essentially like slow things down, focus more on movement quality. You mentioned evaluating the movement, see how good they move. And then through these eccentric, isometric components, just slow things down and make sure the quality of movement looks good. So yeah, awesome. Thank you.
Hey, Tion, it's Joe Repko. Can you hear me? Tiana, can you hear me? It's Joe Repko. There you go. Okay, thumbs up. If you had to pick your top 3 or 5 banded exercises that would hit kind of everything that you're talking about from a protection standpoint or a preventative standpoint that somebody could do, on a daily basis or part of their warm up or whatever, what would those top 3 or 5 exercises be that we can do with bands or something that would help bulletproof different joints and everything?
Yeah, so that's definitely a really good question because we get them so often. I mean, a lot of definitely the more common ones that I think a lot of people can benefit from, especially with shoulder injuries. If, for example, a lot of people are post-op from rotator cuff injuries and maybe even bicep tendinopathies, where we see an inflammation of certain pieces of our kind of joint anatomy there. And so one banded exercise I know you've probably seen or probably done in the past is this, banded external rotation movements that's really placing a lot of emphasis on really kind of giving us a lot of stability at our end range of motion and kind of the whole way through. Because as we pull on that band, we're really getting a lot more resistance on that band probably by the end of that repetition there. And so, that's just a really common one that we often prescribe. And so I think that's probably one of the ones that I think is going to be really effective just for all around like joint stability as well too, because it's a pretty common site for injury, like I said. Number 2, probably, calf raises are another one that we often give to runners as well too. So if you're kind of going through the full range of motion there, up on a step and all the way down, you're really focusing on the proper loading. And again, that proprioception that we're getting as an added benefit. Because a lot of the jumping and the running mechanics involve, quick explosive movements. And so that nature that we talked about with that rubber bands, right? So we're kind of neurologically tricking our body into thinking that, hey, we need to get ready and get primed up for all these explosive little repetition movements. So I think that's just another good one, those calf raises. And then maybe the last one for banded work for joint stability, maybe the knee too. We just talked about jumper's knee as being kind of more of a common thing too, especially for people that have to, repetitively go through that same kind of joint mechanics, joint loading. And so, like I talked about before, the banded quad extension exercises, that slow controlled nature where we kind of kick the leg up so that our foot's up in the air and then we slowly lower down, resisting that tension of that band there. And so hopefully that helps to answer your question, but that's, I guess, one of the more common ones that we work with. And so I think that's really good for just overall bulletproofing. If you're not injured already, then avoiding injury.
Thank you.
Tiana, I don't think we can hear you unless you have your microphone in.
Okay, so Joe, I hope I answered your question there. I still have you unmuted. Hopefully, if you have another question, just let me know here. I'll unplug for a second.
No, I'm good. Thank you.
All right. Okay, so does anybody have any other further questions here? All right, guys. So I'm going to leave my email here in the chat bar to the right-hand side of the screen. If you have any further questions, just feel free to shoot me a quick email, and I'd be happy to answer any further questions that you guys have. So that's going to be all for the session today, but thank you so much for tuning in here, and appreciate you guys jumping on here. So have a good rest of your evening, and we'll see you next time.
Thanks, Deanna. Great job.